Hello, I'm an independent business owner located in Salt Lake City, Utah. I've put together this brief slideshow presentation as a means of informing folks, who may not already be aware, of the state of Utah's long-term plan, originally put into action on March 16th of 2020, and collectively known as the Utah Leads Together Plan, which has been rolled out as a means of dealing with the COVID-19 situation. This plan was drafted and enacted by Governor Gary Herbert and the Utah Economic Response Task Force. It's important to bear in mind that the plan itself lays out general guidelines and recommendations that state and county health department officials, as well as city and county mayors, are to follow. Today's date being the 25th of April, 2020, folks in the state of Utah have by now already experienced the first steps taken as part of this plan. I now feel that it's important for folks to get a clearer picture as to what is coming down the pike, so to speak, as part of the state's attempts at dealing with this evolving situation. Feel free to pause these slides anytime to look more closely and to visit the links for more in-depth information. Let's get started. The Utah Leads Together plan is composed of 3 phases: urgent phase, stabilization phase, and recovery phase. Again, as of this date, April 25th, we are still in the midst of the first phase of the plan. As of May 1st, it appears that the state is preparing itself to transition into phase 2, the stabilization phase. As part of this, the state is looking at reopening parts of the economy. Yet, as will be seen, this reopening will come with a great many new levels and layers of restrictions being put into place as part of what is being called a new normal way of living. It's important to at least touch upon the fact that the budgeting for this plan from the federal level has been carefully laid out, with very specific timelines put into place for the rolling out of supportive funding to states nationwide. The allocation of these funding sources have themselves been laid out as part of a 4-phase plan of monetary operation. In the bottom portion of this slide, you'll take notice of a quote taken from the Utah Leads Together plan, which indicates that for the past 11 years, the state of Utah has carefully built up reserve funding, which is now being used to support measures to deal with the COVID-19 situation. One of the main visual models being used by the Economic Response Task Force of Utah, as part of their efforts to roll out new measures to deal with COVID-19, is that of the iceberg principle. Among other things, this model states that for every person who has tested positive for coronavirus, there are 4 others who are undiagnosed and positive. This 4-to-1 ratio is being treated as an actual fact rather than merely an assumption. As a means of dealing with what is being referred to as the undetected portion of the population, the plan lays out steps to be taken to drastically increase the number of testing sites that are to be made available to the general public. As part of this, the state has established both a website as well as a mobile app, both of which are being put into place as part of a larger goal to provide testing for every resident in the state of Utah. Moving forward, it appears that the state is running on an assumption, again, one that they are treating as fact, which states that COVID-19 will continue to hit the population in waves. The photo in this slide indicates the following. A wave hits, stringent quarantine and social distancing guidelines are enacted, along with business closures, and we see a decrease in cases, at which point things can be opened back up until such time as another wave hits and the cycle repeats itself. Note that the plan itself anticipates that this cycle will continue for the next 2 years from the start of the autumn 2020 season. As a means of dealing with this perpetual cycle, the state will roll out a hotspot model based upon a 4-tier color-coded health guidance system ranging from red, high risk or hotspots, to green, new normal. As part of this, the plan projects that the coronavirus will continue to hit the population in waves. To combat this, every city in the state of Utah shall, at any given point in time, be assigned a certain risk level on the guidance system. Depending upon where a certain city falls within the system, a different set of protocols will need to be followed in a given area for all residents of that city. This will create a constant state of extreme regulatory fluctuation for individuals, families, and businesses. Again, we see the hotspot model. This is what it will look like statewide at any given point in time. So while in one area or county they may be in green, new normal, another may be in red, high risk. Again, different areas will be expected to follow different sets of guidelines depending upon where it is that they fall on the health guidance system wheel. As part of the statewide effort to test every individual living in the state of Utah, teams of testing agents, known as Tiger Teams, will be mobilized to different hotspots for randomized testing. This is being rolled out in an effort to detect the undetected. In an effort to identify new cases, the state will adopt ever more rigorous and broader definitions that shall be applied to supposed high-risk members of the populace. Those at high risk include anyone over the age of 65, as well as those who suffer from immune deficiencies and who are otherwise immunocompromised. Any member of the populace who falls within a high-risk category will be advised to continually limit visiting friends or family and limit attending gatherings of any number of people outside your household or residence. Essentially, this will be a perpetual state of self-quarantine. Here, we see a list of recommendations from the state advising high-risk individuals how it is that they should act and interact going forward. The state health department has already set forth protocols that are to be adopted by supposed high-risk individuals. Note that high-risk individuals are defined as not only those who have tested positive for COVID-19, but also those who have come into contact with such a person. All high-risk individuals are expected to go into a state of self-isolation or self-quarantine. Note that the state health department claims that it has the right to enact such an order based upon state statute. During Phase 1 of the plan, the state used a hospital capacity model to adopt its policies for dealing with COVID-19. Note that the state itself acknowledges that during the first several weeks of the outbreak, the highest capacity experienced by intensive care units statewide was 53%. During Phase 2 of the plan, the state intends to roll out a contact tracing program in which individuals known as tracers will be assigned the task of tracking down each and every individual with whom an infected person has come into contact. These targeted individuals will then be advised to test for COVID-19 and or to self-isolate for a certain period of time, even if no symptoms are present. It appears that the National Guard will be involved in a certain capacity as the main point of contact for the contact tracing program is Lieutenant Colonel Jared Galey of the Utah National Guard. The Governor's Office of Management and Budget is the focal point for all of the data tracking, forecasting, and projection models currently being used in the state of Utah. The federal government itself is getting their data from the Institute of Health Metrics and Evaluation, being run out of Washington University. This is the very same model that is also being used here in Utah. All of the measures that we have seen enacted thus far in the state have come as a result of such models. However, other data shows that even the lower estimates of these models, from those that included full social distancing, have since displayed vastly inflated projection numbers, putting these models in their entirety into question. Dr. Anthony Fauci was even stated as saying, "You can't really rely on models." As a result of all of this complex data gathering, a series of measures were enacted here in Utah through a series of orders, directives, and proclamations from the governor's office on down to the state and county health departments and from city and county mayors. While at the governor's level these are merely treated as recommendations, the stringent nature of these orders becomes more concentrated as it moves down the line. Going forward, it appears that the most force to enact these measures will be assigned to county health departments. In this slide is a list of all of the members of the Utah Economic Response Task Force. These folks all seem to have thrown their full support behind all of the measures outlined in the Utah Leads Together plan. Feel free to give them a call, as I'm sure they'd be happy to have a chat with you about all of this, in an unbiased manner, of course. And so that brings us to the end of this little presentation, which will be wrapped up with a bit of a funny, as I think we could all use that right about now. It's my hope that you found this humble little presentation informative. In no uncertain terms, the Utah Leads Together plan, when taken together as a whole, has the potential to transform the very fabric of society here in the state of Utah, up to and including the way in which we interact with one another on a day-to-day basis. This is absolutely unacceptable, and this nutsy-dotsy plan should be rejected in its entirety. So, if you're looking to get involved with others who are working towards the establishment of common sense solutions based on reality and not computer-generated models, I suggest that you start by connecting with the group Utah Business Survival. They can be found online at utahbusinesssurvival.com. They also have a Facebook page with over 10,000 members. There is strength and there is support in numbers. So if you're one of those who is as concerned about the current state of affairs as I am, I'm sure that you'll find them to be a reliable resource. Take care, and remember, now is a time when we really need to be able to think our way through all of this with reason and logic and in an unbiased manner, rather than to react with emotion. See you around.